Welcome everybody to two events. Event number one today is an International Integrative Medicine Day. Yoo-hoo! Let's do a little dance. Dee, 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 dee. So, just for sake of history, two people, Ilana Seidel and myself, have started this day. And I believe the first one was in 2009 or 2010. So it's been about 15 years now. It's growing. I just get an email from Andrew Weil program that they're celebrating. University of Chicago, no, Northwestern, Melinda's Rings Clinic is celebrating actively. And we're celebrating. So that's our celebration with you guys today. So the day is really meant to be just a kind of acknowledgement. And by the way, why it's today? Because it's 1, 2, 3. There was no particular reason. We just thought that 1, 2, 3 would be funny and very rememberable. So yeah, it's an International Integrative Medicine Day. So it's perfect that we are spending this day today together and doing wonderful practice with Yael. And based on the day, I'm also going to share with you a couple of my just kind of a more philosophical points on where we are and where we're going and in a couple of minutes. But before doing that, the second news, of course, everybody's preparing for I'm going to call it Snowmageddon. I don't know. I haven't heard any better name. So if you guys, if anybody, actually, let's do this. So if anybody wants to drop in the chat your name for what's coming, and maybe we'll come up with something really catchy and, use that for the next couple of days. So there's already a concern about power, sure. So yes, there's very big concern for power loss because apparently it's going to fall very heavy and it's going to be wet snow, according to them. If you believe in weather predictions. So if that happens, we could indeed lose the power. So my suggestions, what we do in our house is we charge all the battery packs. Now we have electric cars, so of course we can charge the electric car fully. In fact, that's probably the easiest way to get the power to the cell phones, to the computers, is if you have a car right next to you. Now, you may not have a car if you don't have a car, but even if you don't have an electric car, just a regular car, park it close to the house so that you can just get in a car, turn it on, and charge your phone out of it. That may be the easiest thing to do if you don't have a substantial battery pack at home. But that's correct. Now, if your power goes down and you don't have an easy way to hit the house without it, then there's a problem. We don't. Our house has a small fireplace, which is gas, and that's not going to hit the house for sure. So you do have to have a contingency plan for that. Find the room that's potentially going to be a little warmer. Try to figure out how you're going to be in there. Otherwise, talk to neighbors. That's actually what I suggest. If you have neighbors who have a wood stove, who have an alternative way of heating the house, be prepared to evacuate wearing your shoes 10 inches or so you can walk through the snow to the neighbor. Otherwise, have also a plan on cleaning your driveway or your walkway and make sure you have at least a couple of days worth of food and water. I think that's probably the most important thing to have. Otherwise, your health, if you have a particular health condition requiring some other contingency plan, then try to make it. So I don't think it's going to be as bad as what we had 12 years ago when we had like 20 plus inches. So 10 inches is about a half of it. I saw predictions anywhere from 5 inches to almost 20 inches. But looks like in the last 24 hours, they're all saying the same thing, 6 to 10 inches. So that's something that seems to be manageable. If you have questions about that, drop them in the chat. Okay. So I have two really quick updates on the colds and flus and COVID. So really interesting update. There's a study that came out just a couple of days ago saying that we now understand why cold temperature causes more colds, more flu, and kind of more viral respiratory infection. Turns out that one of our biggest defense against incoming viruses is an interferon secreted at the level of our nasal cells, because most of the viruses come through the nose when you just inhale. And when we expose to the cold temperature, interferon dramatically drops. So this is a very interesting new study basically saying that in the cold exposure, you're more predictably going to get the symptoms from virus because a lot more cells are going to get impacted as you cannot rapidly block the entry with interferon being secreted. So it's a really interesting idea. The same thing happens when you smoke or you use any toxic inhalants, any kind, cigarettes, cannabis, whatever. So anything you're going to inhale potentially going to impact anything toxic and going to impact the production of protective interferon and thus increase risk of the virus. So that was my interesting update. So now let me give you a little bit of a philosophical view of where we are with our field of medicine and how integrative medicine fits into it. And this obviously fits very closely with two of my upcoming TED Talks, one in just in 2 weeks on polypharmacy, and the other one is on cognitive health in April 11 at Cornell. So it's not a surprise that our healthcare is completely failing. I think no one's arguing over that. Also, what's really upsetting to me is no one is planning any improvements. There are absolutely no conversation on any political level of improving healthcare system. The only conversation that's happening right now is how they're going to make sure more people have insurance, how they're gonna assure that the co-pays for the insurance fees premiums stay low. None of this has any long-term impact on the fact that healthcare system is completely misfunctional and it's rapidly getting worse. The prices of healthcare system is skyrocketing without any limitations. Talking about premiums is not going to fix that. Removing dyes from the or talking about cell phone radiation exposure or discussing mercury in vaccines is going to do zip to the actual problems we're facing. And even if those things indeed have some particular value, which I don't even know, and I'm not going to go there, it doesn't matter. Those are the best way I can describe it is like you're talking about a fly on a wall where you have an elephant in the room you don't want to look at. So this is what we're facing. Who cares about the fly when you have a completely non-functional, totally broken system? So how does integrative medicine fits into it? Well, it's an obvious solution because if we maintain the current process of basically just training our students in prescribing medications, prescribing surgeries, even honestly prescribing a diet, that's not the way to go. Simply trying to teach people lifestyle, the practitioner's lifestyle, is not going to change anything. Because you can teach lifestyle and try to integrate it with the rest of the work, it's not going to improve anything. Because the biggest problem is not that. The biggest problem is the total mentality of a system. The mentality is this: there is a pill for every ill. Or maybe there is a supplement for every ill, or there's a solution for every ill. But that's the problem. The problem is, in general, is that integrative medicine never said that. Integrative medicine says the following: you have to treat the health first. You have to improve foundation of the health before you start looking at diagnoses. And we're completely not talking about it. We're not creating pathways in this country to healthy living. We're giving this up to each person to handle. Here's where I'm not going to give you any solutions and I'm not going to propose anything because I actually not sure that it is up to the healthcare system to figure out how to keep the population healthy. I don't see any will. I don't see any capacity. I don't see anyone talking about this. Everybody's talking about prevention of diseases, early diagnosis, modifying diseases. We're not talking about optimizing health of the population at all. Zip. It almost feels like the conversation is exclusively circles around solutions to problems, not realizing that what we're really missing is why are we so unhealthy? This very simple question. Why is 80% of population past age of 50 is sick? You go back 100 years ago and it was less than 20%. What changed? I mean, we can ask this in a very particular way. We can say, okay, environment is bad. Let's remove toxins out of the environment. That's fine. But that's asking like one out of hundreds, if not thousands, of questions that have to be asked simultaneously. And the most importantly, the question has to be heavily financed and researched. And there is zero interest in the country in that. And we all understand why. A friend of mine, Sufi from Europe, is going to help me a little bit with a talk, and she's going to use this word which I love, the word pilfer. Pilfer. You get that? So basically, the whole industry is pilfering our health. It's basically what this is, man. They're not letting us to realize that, wait a second, if we engage from the other end and we simply say, what are my risks and how I'm going to deal with them and how I'm going to optimize my health before I get sick or before I get any illness, no one's doing this, right? You go into your doctor, you get routine annual blood work. It's complete nonsense. It's completely useless in this perspective, right? You're just trying to catch problems early. That is not a healthcare, right? That's a ill care. So my hope, and this is why I'm talking about this, is that our field of integrative medicine that actually has the core understanding of this is gradually going to move. I will tell you that lifestyle medicine is never going to be a solution. It's too narrow. Lifestyle medicine can only prevent things that lifestyle medicine can prevent. There are a lot more than that, right? So the pie is much bigger. We need all of it. We need functional medicine, lifestyle medicine, integrative, Chinese medicine, naturopathy. I mean, each approach is going to have its own follower camp, and we have to learn to honor that. Right now, system is too fragmented. There's no capacity to bring this and synthesize it and say, okay, well, patient A is going to go to naturopath, and patient B going to go to chiropractor, and patient C is going to go to homeopath, right? Because there is like the standard of care things, that's all quackery. We're not even going to talk about this particular homeopathy. The homeopath is like, oh, the allopath are clueless and they're killing people with their pills. They're not wrong, by the way. And so the point being is there's zero sense of integration of any kind, right? So I think that's what integrative medicine is good at saying, look, we can integrate this and we should. And I hope that next 10 years will create grassroots driven entrepreneurial solutions. That's what I think will happen. I don't believe government will solve anything, whether it's Democrat or Republican. They're too bought out and they're too clueless. They just don't get any of this. Even if there's some pieces are understood, there is no grasping of the complexity. And people who do grasp that, they seemingly are unable to effectively communicate to the leadership. Like I wouldn't know how to communicate this to the leadership if somebody asked me that, right? Because they're not going to listen to this conversation. They're going to say, well, how do you finance this? I don't know. I have no idea. I don't have a business degree. I'm clueless about practicalities of establishing something like this, right? So that's another big disconnect because generally people who are in the trenches who understand the level of complexity of the problem, we're not at the point of understanding how you can bring this to the whole country on a political level. We're completely disconnected from that. And bridging this will probably take many, many decades because the interest is so variable and because there's so much noise and there's so much misaligned incentives that how do you do this? Like incentive for pharma is very simple, keep the status quo, right? If we keep getting, if we keep finding new diseases, if we keep saying there's just another pill that's going to fix this, and if not this pill, the next will, right? We all intuitively understand this is the pilfering I'm talking about. It's a nonsense. Like the idea there's going to be a drug for Alzheimer's is complete nonsense. It's at the core has no value because it will never happen. And people understand that, but they're not, it's still honored as a okay, great, next thing. Let's jump on this. Just to realize that it's not great. And it's just going to take more resources and it's a false pretense. So I'm not going to live to see the day where the philosophy is going to shift to what I'm talking about. I know that for a fact. And I don't even know if my kids will. I hope my grandkids will. Because eventually, and when we exhaust all of this nonsensical approach, there will be a system, there'll be entrepreneurial solutions that inevitably will catch the pharma and the whole industry by a surprise. And that's what I believe in. They're not going to come. They're going to come because they're going to make money and they're going to make a lot of money and everybody's going to follow that. And then there's just old ways just going to die out because there's going to be no feet. People will not vote with their feet to buy their pills. They're going to go to the solutions that's simply going to be better. And that's a healthy way of doing it. Just the problem is if you don't incentivize research into this on a multiple, on a whole country scale, we're not going to get there fast. It's going to take quite a long time. So like Dean Ornish's program is a great example, right? We know that it can prevent 80% or maybe even more, like 80+% of all secondary heart attacks and strokes. And they even got that covered by Medicare. Nobody into there. There's not a single large academic center outside of where Dean Ornish's program was done has taken or upon themselves to deliver that. Why? Because they didn't make it financially interesting enough. And so the business continues as usual. Everybody gets stents, drugs, and surgeries, but nobody's getting an actual approach to avoid all of that. So, yeah. So I think I'll stop at that. We'll take 10 more minutes for Q&A, and we'll make sure we get our 25, 30 minutes with practice because that's what the real integrated medicine is. It's not me yapping in front of you, although I think this yap has some value because I think the more we yap about it and process and think, the more likely we will, gets a little esoteric, the more likely we will manifest, will channel down what actually is possible. So, all right, let's do this. I see Rona's hand impatiently, so let's go to Rona first, and then I'll go back to the chat.
Just a comment. I think mental health has made, in part, that shift because in the beginning it was like Freud and pathologizing, but then other things came along like positive psychology, and I think to some extent mental health has partially made that shift.
No, I disagree. They
Oh,
made
okay.
well, don't mute yourself. Stay here because I want this to be back and forth. You're right in the sense that I think that the therapy became more positive. But look at what happens. What percent of actual patients with mental health who get that therapy? It's less than 50%. 80% get drugs. That's the problem.
I
We,
didn't know that.
yeah,
Hmm.
we're pretending that we can treat a lot of things through biological approaches with pharma because that's what we've been fed. We have no capacity to, so about 30% of population roughly needs mental health, like serious mental health. I'm not talking I'm slightly depressed, I'm gonna talk to psychologists because I have money to pay for that. I mean, we all have our internal demons. I mean, everybody should have a psychologist. That's not what I'm talking about. I'm talking about actual sick people, like people who are suffering and unable to cope with that suffering on their own and unable to fully function healthy. So that's about 30% of entire population. Anxieties, depression, chronic insomnia, I mean, PTSD, all of this combined, I'm talking about, not just one. And only less than half of them, so less than 15% of those patients are actually getting actual mental health therapy. But more than 80% are actually getting drugs. So that tells you something. And the claim is this, that the best treatment is combination of drugs and the mental health. And everybody believes that. So then they kind of, okay, let me take a drug, see if I get better. Yeah. Even though you're correct, I think there has been shift in psychology to something more positive. I don't know if you want to add something to that.
No, it's just that evidence-based research was that, but it's best to combine them, which is
True.
just, of course, it's not always true. It's not always effective.
Well, the problem is that this best research is also very, very pharma influenced. Like the problem with drugs is very simple. And I will tell you that, and I have no concerns about it's absolute truth. For every published positive study, there are somewhere between 5 to 10 negative studies that never been published. So meaning there was a negative result, no benefit, and they never published it. And it's criminal. Because if you actually do publish the negative study, and then you do complex analysis, you find that benefit is so small that it's not worth the price of using most of these meds. And yet we all do, you know. And
Misha,
I'm not necessarily saying it's a huge problem. I'm just saying it doesn't allow for other things to be researched the way it should be.
Yeah.
Misha, there were a couple of questions in the
Yeah.
chat. One was basically, what is integrative medicine trying to integrate? And then the other
Hmm.
was, do you have any examples of countries where the kind of medicine you envision is being implemented?
Great. So, I mean, the whole point of integrative medicine, its key concept has nothing to do with tools. The key concept says that we have an innate healing capacity. We just have to figure out how to support it. That is the statement that is worth everything to me, right? If you believe it, it means that you can find the way out of most of the chronic conditions without a single pill, most likely. Yeah, we just don't practice it as a whole system. And that integrative medicine says on academic large scale of level says, look, we can transform every academic center to lead it this way. And we've been trying to influence this. And guess what? I mean, we haven't moved far at all in the last 10 years, mostly because the infrastructures are so heavy and financially speaking, integrative medicine has never been a winner. It's hard to make money when you spend an hour with a patient, right? I mean, you have to learn to adapt this. And so my hope is that, again, AI and new infrastructures and new entrepreneurial approaches are rapidly going to shift this field because it's going to become a lot cheaper and a lot easier to deliver. So, okay. How do you get influence of big pharma? So JAMA published a beautiful study recently, about a year ago, saying, "Look, there's this big problem. How do we fix? How do we deal with this?" They've done attempts at it. So, like for example, they removed all the free lunches for students from medical schools. When I was in medical school, we've had situations where pharma would bring free lunch for students with free pens. Like you're a student, you have no idea what you're doing. And they would bring you a free lunch and say, this drug works. So of course, what do you think the student's going to say? So that they at least they cut out that. So they've been trying to do stuff like this. The problem is that is not really doing lots because you have to change the entire narrative. You can't just say, okay, let's remove the pharma from medical schools and doctors' offices. What about TV ads? What do you think mostly driving the demand on meds? Not doctors, actually. That's the overall system. One ad does more than, them going to physicians. They're used to be doing that, right? I mean, this entire opioid epidemic was driven by that. They went to doctors and said oxycodone is going to solve all your patients' problems, and then we spent decades cleaning up the mess, right? But again, it's a bigger problem than just one location of impact. So, yeah, Randall, modalities are modalities, but again, the philosophy is different. Modalities is saying, look, acupuncture may be better for treating chronic pain than oxycodone. Who knows? I mean, you can argue about that back and forth, and it's probably not true anyway. Probably individual patient may have benefit from both or from each and whatever. It's a philosophical difference. The allopathic medicine says there is a pathology that appears. We don't care why. Well, we do, but we're not going to worry about that. We're just going to try to fix the pathology. The integrative medicine says, forget the pathology, that's a secondary factor. Your primary factor is to understand, what is blocking innate capacity to heal. And we know we have no resources going into that question. None. We're going resources into lifestyle medicine to understand what lifestyle is better. We're arguing like chickens, is the Mediterranean diet better than plant-based or ketogenic? Like we're wasting our time on shit like this that's completely useless because, well, it's not completely useless. I'm a little bit exaggerating, but it's not fully helpful. The most helpful question would be very simple. What does particular individual needs to optimize their metabolism so that the disease doesn't come in, right? But that requires a completely different way of looking at science and looking at biology and looking at medicine. We're not ready for that. So I don't know any example of country. Honestly, I think there may be. I think Cuba had tried to implement very aggressive preventive model based on kind of a heavy lifestyle and very low cost. Jennifer has her hand up. Go ahead.
Uh, it's telling me I can't, but er,
We hear you.
yeah, okay. Atul Gawande did a article. It turns out it was 2021. I posted the link in the New Yorker on Costa Rica's system,
Hmm.
which sounded pretty health focused. Um, Certainly made me want to move and sign up.
Yes and no. It's both. It's definitely no because, see, the problem is if you take country that's generally 10 times healthier, it's a lot easier to do that. They live in the environment that in itself is so healthier, and they just eat. I mean, they don't have resources to eat shit we eat, right? I mean, they don't have resources to eat all this processed food. Most of their food comes right out of their backyards and, or the backyards of their neighbors. It's exactly the same story with Cuba. Plus there's a lot less cars. They tend to walk all everywhere. That's part of the problem. Part of the problem is we as a society in a very unique space. We're the unhealthiest developed nation because of how our infrastructures have been set up, right? So there may be countries out there that, like, I'm guessing parts of the Europe and parts of the Asia inherently is much healthier and their systems are better. But I don't think we can follow any of those systems easily. That's why I'm not sure that this question is all that relevant to us, unfortunately. I wish it would be. It could be easier to manifest. All right, let me just quickly scan because my time is up. I just want to make sure I addressed all the questions in the chat. Yeah, Steph, that's really well put. I hope so. I mean, I don't know if that will happen, but yeah, so this is a really important point, right? We also tend to compartmentalize things, as Linda put it. We think like the mental health is in the head, or the heart problem is in the heart, or the stomach problem is in the stomach, right? But like that is a nonsense. Everybody understands that too, right? It's a whole body phenomena. In fact, most of the problem in the head turns out to be coming mostly from the gut, like just as a simple example. So that's another thing that integrative medicine is good at saying, look, well, actually, a lot of other systems say the same. Functional medicine says exactly the same. Naturopathy says exactly the same. So there are a lot of, or Chinese medicine, traditional Chinese medicine, they're fully recognizing that particular manifestation of an illness doesn't have to be connected to that organ. It can be a whole body, much more complex relationship that you need to understand. So that's the, all right. I think that's my signal to get the hell out. Right, Janet? So I'm happy to do that. All right, so pleasure to have Yael, who is you all know her. She's been here many, many times. If anybody have last moment question, all right, let me address this last question and we move on. So the difference between functional and integrative medicine is a great question. Because Andrew Weil actually basically says functional medicine shouldn't even exist, that it's over giving people supplements and it's unevidenced and blah, blah, blah. So functional medicine says that most of the disease origin sits in a biochemical shift, that there is some internal, mostly cellular mechanism that went amok, that if you understand it, you can fix it with mostly biological methods. And I actually practice it a lot, and I believe, and I agree that it's at least 50% of integrative medicine is functional medicine. The rest is way more complex. There's a lot of spiritual components. There are a lot of energetic footprints. If you believe in very esoteric stuff like past lives and all that, then it's all there. Functional medicine dismisses all of that, just like allopathic medicine does. So that's the core difference. But they both do believe that if you get away from what hurting your health, you will restore. So functional medicine has that component of nature heals, which I love at the core. But so does naturopathy. Better question would be, what's the difference between naturopathy and the functional medicine and integrative? Naturopathy is a system that predates integrative and functional medicine. I would say that first. It's a system that believes that nature cures, and that concept originates way more than 100 years back. But I have to finish it up. All right, Yael, you're up. I'm gonna mute myself and
Okay. Welcome everybody. It's so good to see so many of you, and also some of you that I haven't seen in a long time in person, and some of you I haven't seen before in AIM, but you're students of mine. So I appreciate you all being here. Janet, I just want to, if you'll let me know, I think I should stop just a few minutes before the top of the hour. Is that right?
Sure.
Okay, great. Okay, So I do want to say, if you haven't seen last week's episode, you could see it on YouTube with JD and Fred, which was such a soulful look at some of these questions about what stops us from healing, what impedes our healing, from both the perspective of the stories that we tell, and also from our connection to source and breath. And so I sort of this week thought I would continue with thinking about connection to source, and how because a lot of us in this modern world, with all the information coming at us and because of trauma, we feel very disconnected from nature and from source. And I'm a yoga therapist, so thank you, Stephanie, for putting it up. From the yogic perspective, source is really everything. It's everything and it's nothing. It's the force that runs through us and everything else, including the things that in the West we think of as living beings, but also non-living beings, like stones and the mountains and the clouds. We could use whatever word we want to use, like life force or essence or the oversoul. But in yoga, the number one way that we connect through that is what's called pranayama, which is usually translated as control or management of the breath. Another way of interpreting it, though, that I love is an expansion of energy, because prana can also mean energy, and ayama can mean how do we extend our sort of small selves out into the big self. So because of that, and because I know that everyone still thinks yoga is stretching movement, so I thought we would give everyone a little bit of what they needed or what they wanted. So we're going to do a little bit of just chair yin yoga, meaning we're going to hold for a little bit longer. And I'm going to introduce you to a few different breath practices at the same time. So we're double dipping, which is one of my favorite things in life to do. It is, in a way, better living through chemistry, but it's your own chemistry. It's your own neurotransmitters and hormones that get shifted when we do this. So the first thing I want to invite you to do, and by the way, you do not need to be wearing cute yoga pants like I am. I've been teaching all day, but just, hopefully you're a little bit comfortable. And just want to make sure I'm bringing my notes, because that makes it easy for me. Okay, so I always say this, but especially for those shorties in the room, it could be helpful under your chair. You could see that I have blocks. You might put an encyclopedia or something like that, just so that we've learned a lot in here about how we want our knees not to be like all the way down here, but about at the same level of the hip. So for me, the blocks is really, really helpful. Okay, so what I'd like you to do, and those of you that want to practice on the floor, that's fine too. You could use a stool as well, if that would be comfortable. And we're going to come into our first pose, which is just a butterfly. You can come all the way to the edge of your seat. You can take your feet together or have them a little bit apart, but we want our knees a little bit wider than the hips. Actually, for those of you who this is okay for, you can also sit back on your chair and come into a butterfly. But just do whatever feels good for your body. This is going to be our centering. So I will also invite you, if it's comfortable for you, to close your eyes, or at least not look at the screen. Like, you might just want to look off to the side and have a gentle gaze at a plant or a photo on your wall that has meaning. You can, for me, when I close my eyes, I get a little bit more internal data. So that can be helpful. And really, there are only three parts of our breath. There's the inhale, There's the exhale. And sometimes there's a little pause or a little dip. It's not very complicated. When we're birthed from water to air, from the amniotic sac into the space outside our mother's womb, we take our first breath. But we were here before we were born. There was still energy and life force. And this breath in this way will be with us until that final exhale, whenever it comes. They say death is like a birth from air to the element of space or ether. Good. So just noticing the simplicity of this breath. And maybe just take a few more right here. Okay. And then feel free to open your eyes. We're going to flatten out through our feet. And then I'm just going to cross my right ankle over my left. And if that doesn't work in your body, you could just stretch out that bottom leg, cross your right foot wherever it crosses. If this is pretty comfortable for you, I want you guys to feel a little something in the right hip. You can also turn this into a little bit of a forward fold. And here we're going to be doing a kind of breath that one of my teachers calls pushing the ox. Actually, with everybody seated up, what I'd like you to do is just find your belly button. And maybe find the belly button with your index finger just for a moment. And then take the other fingers, I hope you can see me, take the other fingers underneath it. And about where the edge of your pinky finger is, like 4 fingers below your belly button, is in the yogic system. This is your second chakra, which is the water chakra. This is the lower dantian. In many traditions, this lower belly is where we hold on. It's where we hold on to our sense, our essence, our energy. So we're going to try to bring our more energy here by breathing into this part of the body. So on an inhale, imagine that you're bringing your breath all the way down into the flowy hips, into the lower belly. Good. And then on an exhale, you're going to push the lower belly back towards your back body and empty out that way. So that's the whole technique. We're inhaling down to our lower belly. It's pretty subtle, so you're not going to see this, but exhale as you release. And for some of you, it might be quite comfortable to hold for a little bit after the exhale. And then you could just let your lower belly fill up. That can be the beginning of your inhalation. Inhaling all the way down to your low belly, but go in your own rhythm. You don't need to follow mine. And then on an exhale, bringing the low belly all the way in, pushing out all the air to the bottoms of your lungs. And perhaps, if it's appropriate for you, pausing. Sort of another way of also cleansing stagnant energy blockages in the energetic body, which has an influence in the rest of our system. Good. So just keep going on your own with the inhale, the exhales through the belly. In the yogic philosophy, the way that we understand integrative is that we have many layers of our being. We have the physical being, but also the mind, the belief system, the energetic system. And so we're always trying to integrate these different layers of ourselves, whole body. So just like so much of our mental health issues begin in our gut, they also might have a neurological basis or an energetic basis or a belief. So we try to take care of the whole self. Let's do just one more round of this. So wherever you are, inhale, exhale, and forcefully push out the air through that low belly. Good. And then it can be quite skillful just to pause here, even while we're still in this shape, and just notice what that did for you. If anything. And then whenever you're ready, I'm going to start to come out of it, but I'm going to lean forward and just move my hip around a little bit. If it's comfortable for you, you're also welcome to just stand up and move that hip around, maybe draw a few circles in one direction and a few in another, but also just fine just to shake it out. Okay, and then as you're ready, let's go ahead and we'll just do the same thing on the other side. So crossing the left ankle over the right. If you can avoid like going into Shalampasana, that's great. But you're also welcome to maybe have a pillow back behind you. Good. And for this one, let's also play. So for that one, we were playing with this part of the body. For this one, let's begin to rise up the energy. So let's notice what it feels like to breathe in and out of the heart. So while we're in this position, and again, some of us might be here, some of us might be here, some of us might be here. You do whatever feels best for you this afternoon. We're going to, again, close our eyes if that's comfortable for you. Or just have a soft gaze. It might be helpful to take a hand over your heart center. I often like here to, some of you have done heart math with me, so I'll often like to start by just gently taking a few breaths in and out of the heart, right behind my hand, right behind the sternum. And then let the breath get really still. And I'm not going to speak. This is sometimes called quieting the heart. And they say that eventually, if you practice this long enough, you might be able to sense your heart, but also feel your heart beating. And maybe some of you can already do that. So let's just be here for about a minute and a half or so. And if it's more comfortable for you to place your hand down, that's cool too. Good. And then again, we could stay in this shape, but just notice what that felt like in our whole system. Good. And then just gently coming out. And again, your leg might be a little stiff. We're working, when we hold poses for longer, we're working a little bit more profoundly with the fascia, with the connective tissue where the energy meridians are located. So you could just move your leg around as I'm doing, or you can stand up and do bigger circles. Just whatever works for you. Okay. And then I should have done it the other way, but that's fine. I'd love for us to just do a little bit of heart opening. We should have done the heart breath while we were doing a little heart opening. So it might feel good, like in my case, my chair, hi, sweetie, my chair is wood. And so I could just hold on to the edge. You might just be holding on to something down and just lifting up through your heart. So see what feels comfortable there for you. Just finding something, you might feel it along the front of the shoulders. If there's something going on with one of your shoulders, just do it with one arm. That's fine. Yeah. And then let's just do a little bit of holding. So let's try it a couple of ways. Let's take a nice big inhale here and then hold the breath. Whenever it feels good, exhale. Let's do 3 rounds just like that. Inhaling, hold, and then letting it go. Good. One more. Inhale. And hold. Good. And just release. So, generally speaking, holding after the inhale is more energizing. It might not be appropriate if you've got high blood pressure or other hyper conditions. Let's try doing it after, but it should be fine with 3 rounds. Let's try doing it the other way, which is similar to what we did before, focusing on the belly. Take a nice big inhale, friends. And then exhale all the way to the bottom. Hold your breath. If you want You can also squeeze through the pelvic floor. And then take another big inhale. Yes, the cats are communicating. Exhale. And consider squeezing through the pelvic floor muscles as though you have to hold in pee. There's nowhere to go. Good. Nice big inhale. And exhale, maybe with that pelvic floor squeeze. We call that Mula Bandha in yoga. And hold your breath. Great. And then let's just do one more minute here. You choose if you do the hold after the inhale or after the exhale. If you've got more hyper conditions, maybe you hold after the exhale. More hypo conditions, maybe you hold after the inhale, not the exhale. Or you could keep it simple and just enjoy your breath, your being alive, your being with community. Good. And then wherever you are, release. Feel free to release a little bit through the shoulders. I always go too long. I wanted to do one last one, but I see that it's 2:57. So I'm just going to say thank you so much. It was so lovely to be with you. Yeah, and cats like yoga. So do dogs.
All right. Thank you. Thank you, Yael.
Thank you.
Yeah, there's a wonderful Facebook post about what's the difference between dogs and cats, and it says something like dogs can name 250 words, they can follow commands, human age 3. Cats don't give F and they full of your S and human age 42. So whether you're a dog person or a cat person, enjoy. All right. Well, thank you, everybody. If you might be and you need to talk to me, please stay here. We are going to discontinue recording in just a second. There's a beautiful question in the chat as what's the difference between holistic and integrative medicine, and I don't have a good answer to that. I think that's actually been debated left and right. I think the word holistic got disappeared because there was a lot of pushback since the regular community felt strongly that the word is lacking any kind of specific meaning. I actually love the word. I felt like this was the better word, but who cares about my opinion? The whole person health or whole person medicine is a term that's potentially the one for the future because it's also sort of means the holism, but it also encompasses the person in the word holism. But yeah, next week, Chris will be here. So next week, I will try to be here. And I will be here, but I may be sort of semi-absent. Well, no, actually, sorry, my bad. Next week, I'm fully with you. I'm talking about the following week. So we'll talk about that. It's because my TEDx is on a Thursday, the 5th. So I will try to be there the day after. I just don't exactly know what my plans will be. So I may just be present, kind of semi-absent. So, but next week, we're welcoming Chris back, which is wonderful. And Steph will lead our practice, I presume. That's great. Thank you, friends. Survive the